In this edition of Living Pulse, cutting-edge surgery from across the globe. Saving limbs, the surgeon who refuses to amputate. Saving lives using the double brain bypass. And saving a man's sex life using a part of his leg. Hello, I'm Dr. Mark Porter and welcome to Living Pulse. Premature furring up of the arteries due to factors like smoking and diabetes results in millions of amputations a year. But for one Indian surgeon, cutting off an arm or a leg is an admission of failure. He's come up with a new revolutionary surgical technique to save limbs, not take them.
This is Indore, in the heart of India, a city of over 1 million people. Ramcharan Nandet has come here from his village. Ramcharan's a driver, but for the last 6 months the pain from his foot has prevented him from working.
I have to do something so I can work. I have a wife and children to look after.
Ramcharan has already been to a local clinic, but his foot has continued to get worse. He can no longer walk on it. He's hoping doctors at the government hospital will be able to treat him. But the news is bad. His foot has turned black with gangrene. The textbook treatment is amputation. The gangrene is due to a condition known as Burgess disease. It affects millions of people across Asia, and every year tens of thousands of them have to have limbs amputated. It's caused by heavy smoking. In India, most people smoke these hand-rolled cigarettes, known as biddies. Biddies are filterless, and the tobacco smokers inhale causes severe inflammation of the arteries, taking blood to the hands and feet. There is one person who may be able to help. Dr. V.K. Agarwal is Professor Emeritus at Indore's Medical College.
Last stage of Burgess, which has taken the gangrene of the whole foot, up to the midfoot. We have not opened the wound because you can see it's still smelling. So he's got a gangrene up to this, and they told that they are going to amputate. He ran away from there and has come here. And we are going to do our operation of omentopexy, and I hope I'll save his life.
Although he's officially retired, Dr. Agarwal continues to perform his procedure, known as an omentopexy. He starts on the stomach. It's covered by a thin veil of tissue called the omentum, which is rich in blood vessels. It's this that Dr. Agarwal will use to save the leg. He calls the omentum the policeman of the abdomen because it protects the intestines from infection, though they'll work perfectly well without it.
This policeman of the abdomen becomes a border security force. I am taking it to the border to save the limb.
After detaching it from the stomach, the next step is to lengthen it. He trims it into a thin strip 1 meter long. This strip is then fed under the skin, down the leg to the patient's foot. The blood vessels in the omentum will carry blood past the blocked arteries in the leg and produce new vessels to restore the blood supply to the foot. The operation takes several hours, and then it's a matter of waiting for the graft to link up with the surviving blood vessels in the leg. Vishwanath was one of Dr. Agarwal's first patients. He now works as a watchman at the Women's Medical Hostel. He's on his feet all day, but when he came to see Dr. Agarwal 16 years ago, he thought he would never walk again.
I used to smoke a lot. 1 or 2 packets a day. Then my legs started to hurt, and after a while, marks began to appear.
फिर मेरे को भर्ती करना पड़ा।
I couldn't stand the pain.
फिर हमारे
I had to be admitted to hospital,
साहब जो थे वहाँ के
and they said they would have to cut my foot off.
Vishwanath still visits Dr. Agarwal occasionally to check on his progress. When he first came to see him, he had severe gangrene.
There is a line between the red and the black portion, so that he has a walking foot. We got a special foot made for him, and he's walking for last 16 years.
Dr. Agarwal deals with inquiries from all over the world from Buerger's disease sufferers, and now his success has attracted the attentions of doctors in the UK for another common but debilitating condition, diabetes. Each year in Britain, 2,000 diabetes sufferers have to have limbs amputated due to poor circulation. David Jones was told that he would lose his foot, but he was lucky to be one of the first patients in the UK to have an omental graft performed by British surgeon Saroj Das.
In retrospect, do you think that you did the right thing to have the operation, to take them?
110% yes. I mean, as you said to me, I was going to lose an ankle, a knee, or a leg.
Yeah.
I've still got both legs, both knees, both ankles, and can walk on both feet.
Let's compare it with the other side.
2 years after his operation, David can walk short distances, and angiograms show that the
Can you move your
transplant has
toe?
increased the blood flow to his legs.
Ankle, yes.
Back in Indore, Dr. Agarwal is extending the possibilities of his omentopexy technique. He's working with an eye surgeon to perform the first operation using the omentum to save a person's sight.
I'll come from here, inside, right up to inside here, then right up to here, then behind the ear, so that not a single scar is seen on the face. And I'll give you a omentum here, and then behind the eye you are going after that.
It's early days for eye patients, but for Ramcharan, the omentopexy technique means there's every chance that he will now walk again. But he is still one of the lucky ones. As long as the medical textbooks say that amputation is the only treatment in the late stages of Buerger's disease, millions more could lose their limbs.
I think he is a very lucky patient. Amputation is the defeat of the surgeon. He should do it as the last resource. Not should be the choice that if he should see if any other treatment can be given and patient can be saved, his limbs can be saved. Thank you.
Dr. Agarwal has since successfully performed that eye operation using his omentum technique and restored the sight of his partially blind patient, a world first. Later in the programme, a new lease of sex life for prostate cancer victims in Brazil.